Good evening, everyone, rethinkers of health everywhere. I am so excited to be on, let's see, I believe it's number 60 of our podcast. Could it be? Yeah, it's crazy, right? I'm so excited that we've been doing this for nearly a year and have really gotten so much positive feedback. And please, everyone that watches and listens and responds, let us know what's working for you as you are leading this yourself on this journey to optimized health. Tonight is someone that I am so glad to have on the show. I've known him for about 4 years. He's on screen from the get go, a very exciting scientist, therapist, philosopher, friend, mentor, uh, healthcare provider, Dr. Ramon Nunez. And he has, his partner describes him as the Forrest Gump of integrated healthcare, meaning that he'll drop names during our interview tonight. And it's crazy. He has trained with, he has treated some of the biggest names in wellness and as well as celebrities. And so he has a lifetime of learning. He is a lot older than he looks, but he is an amazing energy. So Ramon, welcome to Rethink Your Health. And I'd like for people to, I always want to start out with the credibility. I'd like for people to know a little bit about your background. Let them know about how you got into health from being a police officer in New Jersey. And on that note, take it away, Dr. Nunez.
Good evening, Tanya, and thank you. It's a pleasure to be here. Yeah, that is very interesting. As many children have, I know your own grandson started martial arts. And, how old was he when he started?
Eight,
Okay,
nine,
eight.
yeah.
I was six. And what does that mean? Okay, well, at six, what do we know? I grew up in New Jersey and I stumbled into martial arts. And because it was New Jersey and where I lived, martial arts seemed to be something that would be quite useful to me in the future. I'm not a very big person, 5'5", so I don't stand out in that regard. But I did, stand out sometimes as a victim. And I decided, no, I'd learned about martial arts. Again, we're talking six years of age, and I guess I could say I took to it like a fish to water. And I have continued to train up until today. I'm still involved with it in varying ways. And I will be 69 in a little less than 2 months. So I do have a background there. I am a 10th degree black belt in Goju-Ryu Karate. Um, but unlike many martial artists, shall we say, today, who will train in, karate, kung fu, taekwondo, and tournament careers and whatnot, we also know that there's another side of the martial arts sensei, and that is that in many different disciplines, the martial art practitioner, the martial art teacher was also often the local healer or the
Oh, I didn't
bone
know that.
setter. Oh, yes, or the herbalist, which is why, we often see martial art masters who are exactly that, who are master practitioners of acupuncture and herbal medicine and all of these different things. And I was fortunate enough, you got to remember, I'm 6 years old. So I started training in martial arts when the majority of instructors at that time were Asian instructors. And so I was lucky to get a lot of this firsthand. And I continued to train and develop in various disciplines. But actually, in 1974, I opened up my first dojo, my first martial arts school. But as part of that, it was, yes, teaching martial arts, but it was also doing what we considered traumatology or bone setting. Well, because think about this: if you're in a martial art class and you get your wrist dislocated in class, You're not going to rush out to the emergency room. That's not routine. And so the sensei would come in, adjust your wrist, reset it, perhaps recommend an herbal plaster, and get you back on the training floor as soon as possible.
Wow.
Because think about it, in battle, do you really have time to call a timeout? Oh no, I'm hurt. Let me go see, the ref and go see the medic, and I'll come back to the battle. No, you have to be prepared to deal with those wounds, with those injuries in the moment. Okay, that was great. And I thought, yeah, this is something that I want to learn. And I did. I found various teachers growing up. I grew up in New Jersey, but right next to me was Philadelphia with a nice, active, vibrant Chinatown where there were also teachers and practitioners and, these stores that sold concoctions and brews and things that I managed to learn quite a bit about. That led me along the way to becoming a police officer because, service was something that, attracted me. But it was in a city that, quite frankly, has seen better days. And I still, even while I was a police officer, continued my martial art training and teaching, and decided after a few years of law enforcement in various capacities that it was time to move on. And so I thought, well, I can take my martial art training and take it somewhere. I can take my police training somewhere. My choice was martial arts and medicine, but medicine in the sense of alternative or integrative medicine. So I focused on acupuncture and I received my doctorate. I focused on traditional Chinese medicine and herbal medicine and bone setting. Bone setting is not unlike what we today would call osteopathy or chiropractic or various types of manipulation.
Now, let me stop you for a moment because I think it's an interesting transition. I know you personally, so this whole purpose of service, I know you also believe is a part of how we stay healthy, right? You don't
Sure.
serve yourself, you serve others, and that's a very Eastern
Yeah.
philosophy. And so you're saying that you went from deciding whether to do something with police and that service to, service in Eastern integrative medicine. Can you just for a moment tell us what attracted you to Eastern medicine more than, a more Western approach that you could have taken?
Certainly the circumstances of its time. I come from not a wealthy family, so the idea of pursuing medical school wasn't really in the cards. And I already had an understanding or understood the common sense that I got from the concepts of traditional Chinese medicine. It made more sense to me. Now, obviously, back then, I was not involved in science. So, yes, that made more sense. But the other difference was that I saw my own parents. I saw my siblings. I saw people who would go to physicians and come back with a prescription. And if they could afford the prescription, great. But quite often they couldn't. So what was left? Well, those alternatives. And one of the things that I saw very quickly was that some of these alternatives actually worked, and it wasn't like, okay, we're going to do this and 6 months from now we hope for you to be better. No, there were times when things worked immediately, and again, the rationale behind it made sense to me. So at the ripe old age of 30, I thought to myself, well, I'm trained in acupuncture, but acupuncture really wasn't legal at that time in more than a handful of states. And so I thought to myself, well, okay, I could perhaps pursue a medical degree. Well, we know what that involves in the years of suffering and the limitations there. And I thought, well, what other avenue might allow me to practice in the way that I think I want to practice? And I thought of chiropractic. Chiropractic. So I had been a patient of chiropractic therapy since I was 18 years old. I knew many chiropractors. Some of them are some of my martial arts students. But then I thought, okay, I could go to chiropractic school, tie my other training into that and practice. So I moved to Kansas City, Missouri, where there was was a very well respected chiropractic college. And I went out there with my maid at the time, and in fact, she pursued chiropractic, became a doctor of chiropractic. I, on the other hand, I saw some loopholes. I had questions that they weren't able to answer. So I thought, okay, this is not working. So within about 8 months of being in Kansas City, I opened up a martial arts school. And within 6 months of that, I opened up a practicing acupuncture and the other things that I do. And lo and behold, it turned out to be with a physician, Dr. Stephen Bratman, who was starting his career as an integrative medicine physician in Kansas City. He and I partnered. We developed a very good cooperative practice where I saw, some of the best of conventional Western medicine combined with the thinking that came from alternative or Eastern therapies.
And that is the PowerPoint that we start from today. And as you move forward, because I want to get into your current work, which is so absolutely powerful. As you move forward, I know you spent years studying in China. You spent years then in research at Henry Ford, and we'll get into those details on how integrative medicine makes not just a difference, but makes a remarkable, measurable difference compared to allopathic medicine. And so you founded, in your treatment of thousands of patients, a type of therapy that we're calling somatic functional therapy for the release and resolution of pain. That's a pretty big deal. And I know that you've gotten lots of accolades along the way. And I know I wanted everyone to understand that its genesis was in Eastern medicine. Its genesis was about serving others, about movement, but it became something quite scientific. So can you start talking to us a little bit about this science, this educational therapy that you were at the beginning of?
This has been interesting. I think my last title will be the accidental researcher, because that's really what happened. Research, humbug. I wasn't concerned with research. I was too busy seeing patients. And so running a very successful practice and doing quite well, research really didn't enter into it because there wasn't much research going on in this country on the work that we did. But in 2003, late 2002, I found myself in Michigan. And as such, I stumbled on the Henry Ford Health System in Michigan, who were at the time opening up an integrative medicine center. It was, in fact, one of the first hospital-based integrative medicine centers in this country. It was supported by the Henry Ford family from Henry Ford Automobiles. They put money behind it, and they created this beautiful center that still exists, where I came on board, in fact, as a senior practitioner to practice acupuncture and whatever it is I do. And again, I was busy, so the idea of research never entered into it until questions started being asked and about what I was doing. And it was Dr. Alba Rodriguez, who was the co-director of the center there, who noted when she created this research protocol for what work we were doing, because this was an integrative medicine center. So we had chiropractors, we had hypnotherapists, massage therapists, Feldenkrais practitioners, psychologists, counselors, and access to everything that conventional medicine had to offer. And we saw patients for basically everything from A to Z. And patients would come in, they'd make their appointment, and let's say that you walked into that center and you said, hey, I have back pain. Well, there were, 15, 20 practitioners all ready to treat you. in their various ways. I, on the other hand, said, well, I do what I do, so let me leave me alone. I'm not involved in any more of that. But research that was being done at the center was noted by Dr. Rodriguez that, hey, there's something else going on here. And I was approached, well, what is it that you do? I said, well, I do acupuncture and traditional Chinese medicine, but my real, affinity is for doing what I call somatic functional therapy, which I had essentially developed in 1986 when I was still in Kansas City practicing. And she looked at it and she said, well, this is interesting. Let's talk about this a little further. And in trying to explain it to her, she's not a Chinese medicine practitioner. So the idea of me trying to explain to her, well, it's about yin rising and yang here, and no, that made no sense. So I explained to her in English. Well, it's about stress and the stress response and how the body actually works. And I gave her, anatomy and physiology, and she's a PhD, she's a doctor. She said, well, this makes sense. Well, as fate would intervene, there was a request for research on creating a new treatment pathway for chronic back pain and failed back surgery.
Oh.
And, we did not submit a proposal. I was not involved in that. She and her team submitted a proposal based on some of the ideas we had. And lo and behold, there's a long story behind that, but lo and behold, we received $1 million research grant, which meant that day I became a researcher. Quite motivating. And, we did. We said, well, in order to make sense of what we're doing, let's look at these various treatments, the various treatments and practitioners that we had at our center, and collectively create a treatment protocol to help as many patients as we can who are dealing with these conditions.
And so primarily chronic pain, right?
It was chronic pain, back pain and failed back surgery, which means,
wow. And we know
exactly, the worst of the worst. Okay, so what happens with that? As you've heard before, we compared all the various interventions, chiropractic, massage, and all of those combined in a very well integrated program. We compared that with, conventional therapy and everything that we could add on top of that. And it was also compared to somatic functional therapy. And the end result was that the somatic functional therapy group exceeded what all the others combined could do. We're not saying that the others didn't.
40% resolution.
Well, in that initial study, it was somewhere in the area of about 25%.
Okay.
That's, okay, be a little humble. But when you compare that, excuse me, to what the conventional group did, there was no comparison. PT and everything that conventional medicine had offered, 5%. Well, that doesn't compare to 25%.
Yeah.
And so here we are sitting on this data, and it was decided by the team to let's take this to a step further, because I said, well, part of my argument was, look, this is great, and if we could deliver this in a good comprehensive program, we can have an impact. But the numbers are too large. And I said, and I, for one, have been doing stress management, pain management, lifestyle programs in group settings since the 70s. We're talking, I did programs in New Jersey for school teachers.
And you were just considered like a wizard, right? Because, I remember coming into healthcare in the 90s, and all that integrative stuff was just considered wrong, not just ineffective, but something dangerous.
I'm laughing because when you say wrong, no, it was considered outright illegal in some places. Okay, and that's a whole other show. But the end result was that we could deliver this in groups. So anyway, the protocol for the initial research changed from practitioner one-on-one contact to presenting this work to groups, which was done at a major, Fortune 500 company. And again, there the results, exceeded 50%.
And
Now,
I just want to stop you because I want to share, we're going to get to back pain because we know that affects at some point at 20% of all Americans in a way that is debilitating. And when you mentioned that you did group trainings, group somatic functional therapeutic sessions, they were for a car manufacturer. And one of the biggest, I remember reading this, one of the biggest losses financially were their employees to chronic back pain, back surgery, and it was costing them literally tens of millions of dollars per year, which is a lot more today. You went in there with Henry Ford, with Dr. Rodriguez, trained a few other kind of young therapists in SFT. And I remember this distinctly, that there were 40% of these factory workers, probably at that point mostly men, that were missing work, in pain, on pills, facing surgery. 40% of them said, "Hey, Ramon, I don't have any back pain."
well, see, this is the interesting thing because, when was the last time, and my specifically, but when was the last time you or anyone went to a doctor and said, "Doc, I've got so much back pain. Can you help me reduce it by 10%?" No. When you go to your doctor, your practitioner, you're hoping that this person will be able to help you get out of pain. And my understanding was if someone came to me as a patient, it was not my goal to get you down to 10% to help you manage your pain. It was my goal to help you resolve your pain. And that was always the intention in these programs. Yes, if we could manage your pain and help you, that's wonderful. But our goal is always, how can we resolve these problems? Because this idea that, you get injured when you're, in your teens, you break an arm or something, and here you are in your 60s, still feeling pain from that. Okay, at some point, somebody should have helped you to heal. An injury doesn't last 40 years or 50 years. That's nonsense.
Mm-hmm.
And so my approach was always, how can we help you resolve this pain? How can we help you resolve these issues?
Without drugs, without surgery.
I'm not a medical doctor. So number one, of course, without drugs, I can't prescribe drugs. And, I don't know what I would have done if I could have. But the point was that I said, number one, I can help 99.9% of people out of pain in the moment. No question about it. Okay. But what happens after? Okay. After that became patients who I knew wanted to see me, 3, 4, 5 times a week if I would let them. And I'm like, well, no. I'm not here to do your work for you. I will teach you how to be out of pain, how to get out of pain, and how to maintain that. But the key word is I will teach you how to do that. And that's what SFT became. SFT, somatic functional therapy, is an educational therapeutic system, which means that it's about educating you on, first of all, understanding what your problem is. Why do you have this pain? Why do you have high blood pressure? Why do you have stress-related whatever? And what can you do about it? Not tomorrow, not the next day. What can you do about it right now?
Right.
Okay.
And it's interesting because we're going to talk a little bit about what it is and what the science is behind it. But I've been practicing SFT in my own life at least every few days since I've met you, and you diagnosed accurately on a day that I thought I had no pain, rather serious, upper back and neck issues, which in the years, has been diagnosed with an MRI as severe osteoarthritis of my upper back. I don't have pain anymore, but the chiropractor says, "Oh my gosh, you must be in a lot of pain," right? Likewise with my lower lumbar, which we were going to do surgery on 2.5 years ago, which is now, if I feel it, it's only after doing gardening or doing something that involves a lot of bending. And it would hurt whether it was normal or whether it was seriously bulging or not bulging. What's that called? Herniated. But I want to say this. The other day, I was with Dr. Rodriguez, and I was basically laughing, saying, "Hey, Elba, I came up with a better system than Ramon taught me." And she looked at me, and I showed her how, with micro movements similar to the ones I learned with you, but I adapted them in a new kind of freestyle for my back. And I said, I do this, and in 3 minutes, I'm out of sciatic pain. She went, Tanya, you did exactly what we want all of our students to do, which is adapt it to your own body, to relieve your own stress, to resolve your pain. I felt like the best student ever. So could you comment on that process that happened 2 years with your SFP?
It's like I said, it's about teaching. I think the title that I am most proud of is that of sensei, which is teacher. Okay. And it's about teaching you about, number one, your body. Let's face it, medicine, I laugh at this, medicine and law, and in some cases religion are the only people who still use Latin for daily terminology. And part of it is, I think it's because the rest of us are ignorant of that. Okay. Why keep health and healing a secret? When we're all supposed to have that. And in fact, we do. There is no one on the planet, who needs medicines that are available out there. There's nobody who, won't survive without chiropractic or acupuncture or any of that. In fact, most of the people on the planet will live and die without ever experiencing an alternative therapy, or for that matter, a conventional therapy, because healing is self-healing. Yes, a surgeon can do a surgical repair, and a pharmacist or a physician can recommend a drug or a chemical to have an impact on our body to, in some cases, help our body do what it does on its own when we don't interfere with it. Okay?
I think that's powerful to underscore. Healing has to be done by your body, by you. No doctor,
Totally.
no medicine, no surgery.
But
we know
if,
surgery fails.
Tanya, yes, but if these surgeons, if these doctors, if these acupuncturists, these chiropractors, these whatever witch doctors keep that knowledge to themselves, okay, they become exclusive and important and all that. That's well. But my approach has always been, look, if I can teach you how to do it, which we do, then you go ahead and do it. That's what healing is about. There are too many people out there for me to concern myself with hiding this information. And we said, look, how do we get it out there? We had an opportunity, and this is where it really comes to a head. We had an opportunity 10 years ago where SFT was so well accepted by a major corporation that they said, hey, we want this. We want this for our 50,000 employees. And we thought we hit the mother lode. And they said, yes. But in order to pay for these services, we have to get it out of our general health funds. And in order to do that, we have to provide it to all of our employees, which was even better. We said all 50,000, great. Yes, except 25,000 of them are overseas. Oh, well, that presents a problem. Oh, no problem at all. We will provide you with a jet that will take you to all of these various locations. And at that time, we were delivering SFT in auditoriums to 200 to 300 people at a time. And the idea of traveling around the globe trying to deliver this, once again, impossible, realistically. And so we said, well, as time went on, the internet, as it's continued to evolve, has provided that mechanism that says, look, we're not limited to one-on-one patient. We're not limited to a small group of 10, 20 people. We're not limited to hundreds of people. We're unlimited.
Mhm, mhm.
Okay, if
And
we can deliver.
that's the new world of SFT. I'm going to just stop you for a minute here and give people that are listening the Somatic Functional Therapy website. Go on there and please subscribe to Dr. Rodriguez, Dr. Joe, who's an MD, who's also a founder of SFT, and of course, Dr. Nunez, to information, to notification of classes. It's easy, it's free. Just go on there and sign up. I want to get to something that is going to be happening. The dawn of the internet has now allowed you to come back to the world, Dr. Nunez, and say, I need to get this therapy out to millions of people who are suffering. And I know that one of the things that we've heard about over and over again is this pain and opioid crisis and the epidemic of chronic pain in the United States. And you just, blow a raspberry and say, it ain't nothing to do with chronic pain. It instead, and I love this, we have an epidemic of stress, and that is causing the pain. Please talk to us about that because that's the underpinning of SFT.
Well, I'll backtrack a little bit. My history is, as I said, a police officer. But and this was in the 70s. Okay, I started in 1975 at what was the height of the drug problem back then. And in fact, my own younger brother at 26 and a half was dead of a drug overdose. Okay, well, life goes on. What was he looking for? Chronic pain relief? He was looking for chronic life relief, as are so many patients. The idea that people are constantly looking for the high, no, they're looking for more than that. They're looking for relief. And, you know, stress. Stress is the underlying factor, in my opinion, for 99.9% of what is illness out there. We can take it down to the cellular level, and it is what is stressing the organism. And if we can understand that, as we're beginning to, the various sciences are beginning to come together and understand that, hey, essentially we're all studying the same thing. Let's come together. Well, that's what my work is trying to do, and that is to educate so that you understand what is stress. Stress in and of itself is not pathological. One of the examples Dr. Rodriguez gives is, you just got notified that you won a all expenses paid free vacation. How do you feel? Well, one person may say, great, hallelujah, this is wonderful. I've never been able to do that. And the next person says, I've got daycare to worry about. My car doesn't work. I'm unemployed. There's no way in God's green earth I can take a vacation. What are they thinking? Okay, is the free trip the stressor? No, the response of the organism, of the person, to the so-called stressor is the problem. Well, what if you can learn to manage that? And if it becomes more than that, if it becomes pain, what if you can immediately address that? Okay, and address it so that it's not 6 months later you're still in pain. A year later you're in chronic pain. 2 years later you're an addict. There has to be a solution, and I believe there is. And unfortunately, and it's not coming from the medical profession. It's not coming from the integrative medicine profession. Okay, it has to come from both. It has to come from all of them. Over the years, the work I do has been challenged by some of the best. Okay, and I dare say that virtually every challenge has been defeated. Why? Because we're so good. No, because when, if I explain something to you about why you're in pain and it makes sense to you, number one, and you go, well, now that you mention it, all these are factors that I'm aware of and I can understand them. And then we address your pain and it's resolved, then maybe we're on to something. Okay.
And so before you get too far with that, Ramon, what causes the pain response in my body that you're asking me to work on?
First of all, your history. If you've always responded to a painful stimulus in the same way, then you have gotten very good at it. Example, if your response to stress is to hike your shoulders up around your ears and tighten them up like there's no tomorrow, in turn, compress your neck in such a way that it's affecting blood flow to your brain, then you've gotten very good at that. And it takes how long for you to do that? An instant. Okay. And it's not like, oh, well, I just felt the stress. Hallelujah. Now I'm done with it. No, we become very good at holding on to that. And so we're walking around not in neutral as we're supposed to be, but in 10%, 20%, 30%, 40% stress loads, 90% stress loads. And then somebody says, I don't understand, he was doing great. And then he had a heart attack because somebody cut him off in traffic. What is if somebody cutting you off in traffic stressed you out to a point that you could have a heart attack? Well, if you're at a 80%, 90% heart attack level already, what's it going to take you over the edge? Okay. Well, what if you can intervene before that happens? In Kansas, where I lived for a while for 16 years, I owned and operated the Kansas Longevity Center. And people would often ask, wait a minute, you're doing acupuncture and all this, it's longevity? What's up with that? I said, look, it's real simple. I want to live for as long as I can in a healthy state of mind, body, and spirit. And what's it going to take to get there? Okay. Longevity. That's what it's about. How can I live longer, better? One thing I know, I can't live longer, better going from doctor to doctor to doctor for the same problem.
Or not from drug to drug to drug.
No, it doesn't work.
Right.
But if I learn along the way on how to actually deal with the stressors in my life, stress occurs in you. People say, well, it's the stress of winter. Not to a Siberian husky, winter means nothing. It's nonsense. There are some of us who love the heat. 40-degree temperature, I could be out there in shorts. Doesn't bother me. My body's hot. But some people can't tolerate that to save their life. So what is it? It's how we respond to that stimuli that we define as stress. As a police officer, I was trained to tolerate whatever nonsense was thrown at me. If somebody yelled and cursed, it didn't matter. I'm supposed to tolerate it. But that didn't mean it didn't affect me. And imagine putting up with that 20, 30 years. And then it's like, but he was the nicest cop, and all of a sudden he lost it. No, he didn't lose it. He worked 30 years for that. That's stress. I said I taught school teachers on stress, like they need to be taught on stress. Well, their stress is a little different, though. Oh, well, they're stressed by overloaded, classrooms and too many books or not enough books. Well, yeah, but they're also stressed about the fact that they got thrown up against a locker in the hallway during, class change and had a knife put to their throat. That's stressful. How do you deal with that? That's what I teach. That's what SFT is about.
Wow. So SFT is really how to master the stress response. I've never.
Yes. Without the stress response, you die. There are children born without the ability to perceive pain. And I've had patients tell me, if there was any way that you could do that, or a doctor could cut the nerve so I wouldn't feel pain. So yeah, we probably could do that. It's called paralysis in some cases. But if you couldn't feel pain, you don't live very long. Pain, is a signal. Yeah. Pain is a signal to your brain to pay attention. Not run to your doctor. Pay attention first. What's going on in your life that is presenting itself and expressing itself as pain. You know, I love the question that every practitioner gives. Well, what's your pain from 1 to 10? Oh, well, it's an 8. Hey, pal, my 3's more than your 9 will ever be. I've had that comment as well, because pain is a personal experience. My pain today is not my pain tomorrow. But learning to resolve that, learning to recognize it before it becomes a problem, that's what SFT is about, is understanding that stress response. Stress response doesn't mean you recognize stress. Oh, it's the stress. No, it means respond. If
Yeah,
you're stressed,
pain has
respond.
right, and pain has a real role. You know, like we need pain. If we burn ourselves on the stove, that's acute pain. Our stress response is take your damn hand off of it, run it underwater, and you'll be okay, right? But the chronic pain that most of us are feeling after an injury or after something that goes on for a life is what we're saying here. The brain is processing as your daily stress, life being difficult. And I think that's why we're seeing so much more chronic pain in this epidemic. It's just insane the amount of pain management programs that
Yes.
are springing up. And then there are people saying, oh, those are just drug,
That's right.
pharmacies. But the issue is really much bolder than this, is what I hear you saying, Ramon.
Well,
It's a society that doesn't know how to handle the contraction of our lives.
As an example, chronic pain. So I'll use chronic frozen shoulder as an example. I'd like to use only because, quite frankly, when you see this, it's mind-boggling. I've had patients come to me who have had frozen shoulders 6 months, a year, 5 years, 10 years, who have had multiple surgeries on those shoulders, who have had manipulation under anesthesia where they are literally put in an OR, not knocked, but anesthetized. I wish it was knocked, and then manipulated, okay, and then months of rehab afterwards. And you see the results. Oh, well, it started here before all of that, and now look at me, I can go to here. Okay, I have patients, and you've seen the videos of patients who, after months, years of frozen shoulder, adhesive capsulitis, and whatever else they're calling it today, resolved in under 30 seconds. Now, how is that possible?
How is that
First of all, I explain what's going on. And then they go, oh, well, if that's true, that makes sense. Okay, if it's true, I'm going to teach you something. And if you learn it, here's the expectation, which I have, which is we're going to resolve this. And 30 seconds later, they go from this to this, then I must have been right. And that's what I say. You can, you jump into a pool 5 minutes before massive chronic pain, you break your neck. Guess what? Your pain's all gone. All that pain gone. In how long? 1 second. What happened? Something disrupted that signal from and to your brain that you were perceiving as pain. I have a much better way to do it. For you to learn it, for you to learn your anatomy, your physiology. I'm not saying everyone needs to go to medical school, God forbid. What I'm saying is everyone should understand what their own body is and how it functions. I mean, I think that's pretty basic, or at least it should be. And that's what I try to do with all my patients is, okay, understand, what is your shoulder? How does that shoulder work? What is the priority of your brain with that shoulder? You think your brain wants to limit that shoulder? Absolutely not. Okay, then let's see if we can understand why it's doing it and how it's doing it. And when you figure that out, in less than 30 seconds, I've had patients with chronic back pain. And again, I'm not the one doing it, they're doing it. Chronic back pain of years duration. Okay, they lay on my table They get up 30 seconds later and they tell me, because I can't tell them their pain is gone, they tell me my pain is gone. So I believe them because I see them jump off the table and march around and jump around and tell me my pain is gone. Those that then take the lessons and practice them, I never see again. I don't have to. They've learned. And that's what SFT is about. You know, we have two tracks in SFT. One is the educator, and that is someone who we train to educate people hands off. That means they can do it online, they can do it in conference rooms, in presentations, or wherever they want. But there's also a more advanced track that is for practitioners. And that is where we train practitioners to actually deliver the hands-on protocols, the hands-on lessons. Because there are some people who, for many reasons, number one, maybe they can't get it. Maybe their knowledge base isn't there yet. What am I supposed to say? Oh, well, come back to me in 6 months when you've learned enough and I'll help you with your pain? Can't do that. So there's a hands-on approach that can be done by the practitioner. And that's a second track that we want to present. And it's about how do we train practitioners? Well, you know, I got lucky. I wound up with Dr. Alba Rodriguez and Dr. Joe Slukowski. Dr. Rodriguez, a leading neuroscience, and Dr. Slukowski, an MD far beyond any of them. Together, you know, the three stooges, we knock our heads together and we try to make sense of this. And look, do they challenge me on some of my theories, some of my concepts? Oh, you bet they do. And then I challenge them back, and then we come to a consensus. Oh, well, maybe, you know, this is this and this is that. Let's make sense of it. So then we take it to Harvard. And what does Harvard say? We don't care if you perform miracles in front of us. If it's not published in the New England Journal of Medicine, we're not interested. So what do with Dr. Joe Slukowski? We go to the New England Journal of Medicine. We're in their offices. We talk to their presidents and past presidents who have problems of their own. We tell them what we do. They love it. Oh, yes, I want to do this. I would never hear from them again. You know, what are we supposed to do? So we said,
you know what? Just this week, Ramon, just this week, the American Psychological Association, you know, the largest, the APA published a survey of research that just, you know, the medically evidence that psychological stress manifests in physical pain, and there's no difference between the two, right?
That's right.
So basically, they're saying there's no superiority of the body over the brain. It's one and the same. And one of my favorite things is the title of a book that you're working on, Retrain the Brain to Resolve Pain. Very fun, very simple. But I love this cycle, right? It's about disrupting this cycle of pain. So let's get to the back because we don't have much more time. But most people feel the stress of their lives. Yes, they could have been in a car accident. Yes, they could have lifted up something 5 times too heavy. There's lots of physiological trauma, but most of us feel chronic pain in one of two places, the kind of upper mid-back or the lumbar region. And I know that you can see MRIs of damage because I have one of the most damaged lumbar regions on an MRI that my surgeon ever saw. He would not let me go to physical therapy or to a chiropractor because he was concerned that the manipulation would cause me to be paralyzed, to damage nerves, right? So now when I go back to him and he looks at it, he says, you know, it still looks pretty bad, but the inflammation is gone. There's movement and you're not in pain. Are you sure? Are you taking the marijuana I prescribed for you? What are you doing? And I'm saying, no, honestly, I'm doing a couple of these moves. I'm taking antioxidants. I take my muscadine. I also take curcumin when I can. I believe in turmeric. But man, when I feel the pinch, if I go bike riding sometimes, that leaning over for an hour
That's
or
right.
so, I just get into those SFT micro movements very carefully, telling my brain, relax, breathe through, go through, go through. And literally in 2, 3 minutes, that sciatica like debilitating pain disappears. It's not magic, those that are listening. It's called SFT. And I promote Ramon and Joe and Elba like nothing else because they have been my salvation. I could have been, I'm a single mom, grandmom, raising 2 very busy kids. And the surgeon said I'd be on my back anywhere from 3 to 5 weeks. And I'm like, that's not possible. It's not possible. And life is possible because of you, Ramon. So let me just ask you this quick question. What is causing chronic back pain in almost all of my friends? They all come over and they use my hot tub. So there's a hint.
You have to understand. Okay, let's go. We're you and I are old enough that we remember standard shift cars, right? No automatic trans, but even automatics have a neutral. Okay, so
Mhm,
what does it mean when your car is in neutral? It means theoretically it's not moving.
mhm,
Well, but actually it is. The motor's running, the transmission's pumping fluid, the radiator's pumping, there's electricity running through the system, but it's in neutral. Okay. Now, let's imagine that you're able to function all day, do the things you do, whatever they are, good, bad, or indifferent, and then it's now time to relax and go to bed, and you're able to go into neutral and your body recovers. Okay? That's how we were when we were kids. Okay? You take a 10-year-old and they run themselves ragged, they're exhausted, they fall asleep instantly. What happens if they happen to nap for an hour? They're ready to do it all over again. And you're
exactly.
like, my God, I wanted the little bugger unconscious for at least 10 hours. No, because there's so much more energy there. Well, guess what? We're bigger than them. We have even more energy. But getting back to neutral, what happens if your car is, I'm sure at some point you tried to drive away when you weren't in first gear, maybe you were in third gear. And while you can do it, you got to juggle that pedal and that, that gas pedal and that clutch. And okay, well, when you're stressed, your neck may be in second gear. Your
Hmm.
low back may be in fourth gear. And now it's time to go to sleep. And now your low back goes down to third gear. Well, when did it ever relax? It didn't, which is why you get up in the morning for many people, and they're even stiffer in the morning after so-called 8 hours of sleep than they were when they went to bed. Oh, yeah, they were more sore perhaps when they went to bed, but this so-called stiffness, stiffness is muscles that are in contraction, that the brain has put into contraction and has stopped sensing.
Hmm.
And so if we can get your brain to notice, I use the example, if you went to bed tonight and your arm stuck up in the air, you'd look up and you'd go, that's not right. Something's going on here, right? Okay, but when you go to bed and your low back on the left side or the right side is 30% contracted, 40% contracted, your shoulders are 30, your neck is 20, your right knee is 40, you never get to neutral. And
And you
so
can take all the pain pills and sleeping pills that you want. They don't do anything for your muscles.
they're sedatives. The idea that, in my opinion, that there are any such thing as muscle relaxers doesn't happen. To me, the most effective muscle relaxer, one of the most harmful, alcohol.
Hmm.
Alcohol will relax your muscles better than probably any drug out there. But the cost is beyond. Okay, your brain is supposed to do that. Again, go back to that baby. Okay, go back to your little girl there. When she was little, they fall asleep. You pick them up. Hope to God you don't wake them up. They'll fall asleep in any position possible. And yet, how much have you spent on mattresses? I know we've spent more than we need to Oh, got to find the right bed, the right pillow, the right mattress, the right this, the right that. It makes no sense to me because, yes, I have lived in China and slept on dirt floors and some of the finest hotels, I might add, you know, and I got to tell you, my back didn't really feel any different. I've slept in many a dojo floors, so be it. It's like, no, it's not the mattress, it's how your body adapts to its circumstance. Okay, to its
That's
circumstance.
fascinating.
You know, and
That's
that's what SFT teaches you. It's
Mhm.
not how to take on life with all the gusto. It's how to adapt. It's how to step aside when you have to step aside, let it go past, and how to take it head on when you have to. Sometimes you got to duck. Sometimes you got to face it head on.
Mhm.
Okay? And what if you can learn when those times are most appropriate for you and you're able to do it?
Mhm.
Okay? That's to me what it's about. I'm physically as strong today as I've probably ever been, but I'm, going to be 69 years old. But I expect in 30 years to hopefully be at least as strong and as functional and as vital as I am now because I know how to do it
Yeah.
and I know how to teach it. Yeah.
And that's a beautiful way to wind down this podcast. There is a resolving back pain workshop coming up in January. I'm really encouraging you as you listen to this to please go to www.somaticfunctionaltherapy.com and subscribe. In lieu of that, you can always message me on any of my platforms on how you can learn about a $99 seminar. It's usually more expensive, but as we heard earlier, Dr. Nunez wants to reach the masses with this message, and he wants to train you to help others and to really build a community around SFT that helps, dare I say, reduce addiction to drugs and alcohol. Because as we all know, that's a form of self-pain medication. We don't need it if we can learn to be our own hot tub. Like I jokingly said the
Mhm.
other day, I had a little kids party here and all the moms came and said, "Oh, my back is killing me. I need the hot tub."
Yeah,
Wait a second. What they need is their muscles to relax. And
that's
there
right.
are, right, because they're disrupting the pain. It's not like there's opiates in my bathtub, or my jacuzzi. And so it's really phenomenal to begin to think about how simple this theory is that Dr. Nunez is talking about, that as soon as we learn to disrupt the pain signals from our back, our neck, our knees to our brain and release the contracted muscle, with that is natural painkillers when your muscles are in a relaxed state. And man, we live pain free. Now, I can't say I'm pain free. I can say that every once in a while my knees still hurt, but it's usually if I'm doing more than normal activity.
That is it, look, Tanya. That is it precisely. That's like saying, "Oh well, if I stick my hand with a needle, it doesn't hurt." Wow, that was fabulous. No, it's supposed to hurt. If you overdo it, it's supposed to hurt.
Yeah,
Okay, and
yeah.
when you overdo it, you're supposed to go, "Oh, let me do my SFT. I know what to do."
Exactly. So I'm excited. I'm very, very excited to promote this podcast. If you've seen this podcast, please share it. But most importantly, there's that little scrolling banner underneath us, somaticfunctionaltherapy.com. Easy to subscribe. I am hoping that Ramon tells me 20 people are new tomorrow to his work. And we want to help you with that aching back, with that sore neck, with those arthritic knees that you think you will never run again. I can bring my 11-year-old grandkid in here, and he will tell you that I nearly beat him in a race to the car tonight on these knees that doctors said I wouldn't walk well on. And that was 10 years ago because I was dancing a lot.
Yeah.
So it's possible, guys. And Dr. Nunez, Thank you so
My
much.
pleasure.
I'd love for you to give a message of what you really hope. We hope everyone comes on to somatic functional therapy and learns more about what you do. But in the meantime, what is your wish for the overall health of everyone that is listening? What do you wish that they would learn and take away from tonight's podcast?
Learn that you are your best doctor. Okay, doctor from the Latin word doctura, which is for doctor, which is to teach. You are your best teacher, but you need other teachers to guide you along that path. Okay, it's about learning. It's all about learning, not about what is done to you or for you. It's about what you learn to do for yourself.
Great.
That's it.
That's a beautiful
Learn.
message. We are our own best doctors through learning, and that stress is really the foundation of pain. And yes, it's needed, but not chronically. Thank you, Ramon.
Thank
Thank
you,
you.
Tanya.
And anyone that's watching, remember somaticfunctionaltherapy.com. And we will see you next week on Rethink Your Health. Thanks again.
Bye.